morning. My name is John Thomas. I'm a physical therapist at Laguna Orthopedic Rehabilitation. As you can see, I have my cycling gear on. I just got done cycling, and today I wanted to discuss some of the things I work with on the cyclist. And today in particular I want to talk about hip pain and low back pain. Now, when we're cycling, we're in this position where you're seated and you're performing this hip flexion moment where the knee is coming up towards the chest. If you're a triathlete or even a roadie and you want to get into a more aerodynamic position, now you're down even more, where you can see this angle shortens a little bit more, which if you don't have the motion needed in that, you can cause some things to happen in the body which can lead to pain. Like I said, I wanted to talk about hip pain and back pain. So with hip pain, two things that can be a cause of it that I want to discuss is hip flexor, or the iliopsoas, or the hip joint itself can be tight. Now, in a recent video I showed everybody how to work on releasing that tightness in the hip flexor with the foam roller. Quick review: you can lie onto the foam roller, find that spot in the hip. You can rotate your body left to right till you feel that hot spot, and you're just working it back and forth, trying to loosen up that muscle. You can be on that area for about 5 minutes. Once it's nice and loose, you want to stretch it. Now, there is this stretch that you may have seen where you're in this half kneeling position and then you're lunging forward. What you need to watch for is when you're in this position, you want to make sure that your abdominal muscles are engaged and that you're tucking your bum underneath. Many times I see people stretching this and they're really getting a lot of that motion from their low back. So you really got to make sure you keep the abdominal muscles engaged, tuck that bum underneath, and that already I feel a good stretch. Fault is to arch the back. So you really want to tuck it under, engage the abdominal muscles till you feel stretched, and then you can slowly work into that lunge or add that arm up. So you're feeling that opening up that muscle all the way in front of the hip. The next thing I want to show you, this is a stretch strap. It's from Rook Fitness. It's really thick. There's a lot of different thicknesses, but you can loop it around a pole. And this is going to help improve the joint mobility in the hip. You step into it, and you put it right around the groin region. Now the height of this band, you want it to be parallel with the ground. So you have to adjust that a little bit. And then you're sliding away from that so that you get a pull laterally. The hip is a ball and socket joint. And what happens as we flex down, or when we're cycling, if we don't have the motion required, this angle can get impinged upon. So you're putting it around the groin region. You're not letting your low back, I don't know if you can see this angle, swing it around. You're not letting your low back flex, so you want to have it arched, so you're locking out the low back, and you're slowly sinking in, and your goal is to feel stretch in your glutes. If you feel any pinching in the front, that means that you have tightness in that capsule in the hip. And if there's tightness there, and you're doing this cycling motion, 50 miles or more, that's going to start breaking that hip down. So this is a good stretch. It's right on the groin. You're locking out that low back. You're slowly sitting back towards your heels, and you're shooting to feel a stretch in your glutes. Now, people with back pain, because they have hip flexor tightness or capsule tightness, when they're cycling, they're getting to that position and their back starts to round. That puts a lot of tension on those paraspinal muscles and the erector spinae muscles in the lumbar spine. Being in that position for hours is going to result in, feeling some of that back tightness or pain. So 2 exercises if you want to work on improving that hip joint mobility so that you're not compensating from your lumbar spine. That'll give you some relief off the low back. The hip flexor stretch after you do some of the foam roller getting into that half kneeling position, making sure that you're not arching the back as you lunge forward. And then lastly, making sure that your bike is in the right position for you. So getting a bike fit done I highly recommend that, because as we all know, we want to get into that more aerodynamic position, but if physically we don't have the flexibility or the joint mobility to get there, your body's going to compensate and you'll get stress in other areas. Hope this helps, and maybe I'll see you out on the road. Thank you.